Welcome back to the Get Well podcast with Dr. Kevin. Thank you so much for joining me on another show today. This is the show designed to be your bridge to a healthier future. And I've got a good one for you today. Today's topic is going to be one of the most misunderstood topics in healthcare, and that is cholesterol. People have so many misunderstandings about what cholesterol does in the body that I felt like it was time to dispel some of these myths about cholesterol and discuss what the new science says. And so it's time to set the record straight. Now, I want you to know that many of the quotes and data that we're going to be discussing today comes from one of the world's leading interventional cardiologists named Dr. Stephen Sinatra. Dr. Sinatra has authored multiple books on the subject of cholesterol and the myths that surround it. And I've studied his work for almost a decade. And so I'm going to be quoting other researchers as well from some of the leading research institutions around the world. And these researchers have now concluded, and I agree, that cholesterol does not directly cause heart attacks. Now, the general public out there would go, what are you talking about? Of course cholesterol causes heart attacks. Everyone knows that. Well, the way Dr. Sinatra puts it in his new book, it's at the scene of the crime, but it's not the perpetrator. The connection between LDL, the bad cholesterol, and heart attacks is just not there. It's just not what the new literature says, folks. And so that's not only my opinion, but it's also the opinion of the Minneapolis Heart Institute, NutriTooth.org, Dr. David Diamond, John Barron, Dr. Mark Hyman, and so many other practitioners that have really taken an honest look at this whole subject of cholesterol. Dr. David Diamond, who's a world-renowned researcher, he's the professor of molecular pharmacology at USF, and he published an article in the medical press October 1st, 2018, and he stated, there have been decades of research designed to deceive the public and physicians into believing that LDL causes heart disease, when in fact, it doesn't. End quote. He also said that research has been terribly flawed and that there is a complete lack of evidence in the causal link between bad cholesterol and heart disease. So Dr. Diamond, along with more than a dozen other cardiologists and doctors, everywhere from the US, Sweden, UK, Italy, France, Japan, Ireland, and they said that the current narrative that LDL causes cardiovascular disease uses misleading statistics, unsuccessful trials, and have ignored multiple observations that it does not cause heart attacks. Yet statin prescriptions have not slowed down at all. It's time for an update whenever it comes to how we prevent our good folks here in Acadiana from dying from heart disease early. And by the way, the cholesterol we're talking about in these studies is LDL. That's the bad cholesterol. Not to mention total cholesterol numbers and how vague that is in having to do anything with pretty much anything negative regarding your health. There's not much of a connection between bad cholesterol and heart attacks, much less something as vague as your total cholesterol numbers. But patients come in and say, Doc, my total cholesterol was 280. The insinuation there is I could have a heart attack at any moment. It just isn't true. According to all of these experts and all of the new science, there's just not a connection. There's now better tests and new science that can actually tell us if you are at risk of plaquing. Isn't that what everyone is really worried about and wants to know when we discuss cholesterol? So if I ask you, why are you worried about your cholesterol? Well, I don't want to have a heart attack. That's what everyone is so worried about, right? And so there is now a new science that, although it's a little more complicated than good and bad cholesterol, it's way more promising in the connection with cardiovascular disease and heart attacks. So, Acadiana, listen, we need to take a really hard look at what the new science is telling us. How can we help the good folks here in South Louisiana live their longest, healthiest life without dying early from all of these heart attacks? Which, by the way, guys, 40% of the time, the first sign of heart disease, fatal heart attack. So that means this guy may have felt perfectly fine, kissed his family goodbye, and died on the way to work with no previous symptoms. Guess what that number is in women? 65%. The first sign of heart disease that a woman has 65% of the time, heart attack. So we now have advanced testing that can cause or can tell us a direct link between these numbers and cardiovascular disease. Which, by the way, many of the more advanced states, and I hate to say that about Louisiana, but the advanced states and offices and the advanced clinics around the country and around the world is now doing what we call cholesterol fractionation tests on their patients. Now, we also do that test in our office right here in Lafayette because you deserve the very latest and the very best. But what cholesterol fractionation means is that we look at the particle types of the patient's cholesterol to see if they have the small, dense, sticky particles that are actually the ones that stick to the side of the arterial wall. This is a simple marker on blood tests that can show us if you have the sticky, dense ones or not. So guys, back in the 1970s, cholesterol was one number, total cholesterol. That's all you got. And then in the 80s and 90s, they realized, oh wait, some of them are good and some of them are bad. It's not 1998 anymore. It's now 2022, and it's time to move beyond this old science to something better. We have new technology to determine what the actual particle types of cholesterol this patient suffers with. Because not all cholesterol is bad. In fact, quite the contrary. Cholesterol is a very important molecule for us to have in our bodies. The human brain is something like 40% fats and cholesterols. So if you crash your cholesterol level to these ridiculously low levels with these statins, brain health suffers. This is one reason dementia is skyrocketing. In some of the cases, we've crashed their cholesterol so low that they lose mental capacity. One study done on Parkinson's disease showed that for every 40 points we raise the patient's bad cholesterol, they have a 15% less chance of dying. Cholesterol surrounds most of your nervous system tissue, including your brain. Cholesterol is also used to patch up the body, like leaky gut or a leaky blood-brain barrier. Cholesterol is used like spackling you would use on your wall to patch a nail hole. The body uses cholesterol as a patchwork of repair. Cholesterol also stabilizes your mitochondria to make more energy in the body. Now, you guys have heard me talk about energetic debt before. If you've heard any of my speeches, that means that your body is not making enough energy. So does it make sense that if your energy is low, your body might want to increase your cholesterol for your energy output? The lower your energy, the higher your body wants to raise your cholesterol. Your body is trying to fix something, and that may be hurting the ability. Cholesterol also helps in cell division of your chromosomes to work normal. And when your chromosomes don't work normally, you get something called cancer, and that's never a good thing. What are the cancer rates doing since we've crashed everyone's cholesterol? They're going up. The other thing that cholesterol is used for in your body is that cholesterol is the precursor for your body to make testosterone, progesterone, and estrogen. Your body actually uses a molecule of cholesterol to build testosterone, progesterone, and estrogen in your body. So testosterone starts off as a cholesterol molecule, So does estrogen. So does it make sense that if your body doesn't have enough of these reproductive hormones, if your testosterone is low or your estrogen and progesterone is off, does it make sense that your body may want to push up your cholesterol, the precursor to these other hormones, so that you can make more of those? Your body may be raising your cholesterol for a reason, and that's because you don't have enough testosterone, progesterone, or estrogen. And so all of this has to be looked at. You're making it more difficult for your body to do that, honestly, for no reason. There's no upside. So you go to the doctor after he puts you on these statins for 2 years, and he says, well, your hormones are completely off. It's just due to your age. It's that time in your life. You need more medicine for that. Here you go. We can do better than this, guys. We need to do better for our great folks here in Acadiana so that more people can have more time with their kids and grandkids, so that more people can live a longer, healthier, and happier life for later into their life, for later into their years. You know, guys, we only get one shot at this life. My purpose in life, other than to be a great dad, is to teach people that their health is the most valuable thing that you have, and your life doesn't have to get cut short. That you can sit down and figure out a pathway so that you can live a longer, healthier, better life without relying on a pill for everything, and you can be your healthiest. You can manage your body and your heart without relying on statins to treat LDL, which means almost nothing. It is the sticky cholesterol particles that are the problem, and we aren't even testing for those. But we test for them right here in Lafayette. Now, if your arteries aren't inflamed, then even the sticky ones can't stick there. So inflammation has to happen first. So why is that? It's the sugar and the trans fats and the chemicals in the body that creates the inflammatory process and the damage in the endothelial wall, which is the lining of the blood vessel. Your body then uses cholesterol as a patchwork over this inflammation. The cholesterol is there because the body uses it like scaffolding to patch damage from inflammation. It uses small, dense particles to do that, which we can test for. So testing you for these small, dense particles and testing you for inflammation is so beneficial in determining how to improve your heart health. It's the sugar, the trans fats, the carbs that we eat that's creating the inflammatory process to take place in your body. And then it's the sticky particles that cover that inflammation. But make no mistake, the inflammatory process in our endothelial lining is what starts the plaquing process. Now, guys, that's way oversimplified. I want you to know that that's not a complete description, but it's way more of an accurate description than to say, well, you eat too many eggs and the cholesterol from those eggs has gotten stuck in your arteries. That has now been totally debunked. For almost 20 years, we've known that that's now not what actually happens. But there's just still not caught up to current times. It has nothing to do with eating eggs or eating too many fats. The poor egg industry took a beating in the 1980s and the 1990s. Eggs were demonized. Butter was demonized as the worst thing you could possibly do. I eat real organic butter every day with my eggs, and I'm actually in the process of trying to raise my cholesterol up slightly. Because when I did my last blood work, when I checked mine, my cholesterol was slightly below optimal cholesterol levels for brain health. And so there is an important range that we need to look at. There's nothing wrong with eating real organic butter. But if you're still eating margarine, country crock, butter-like spread, any of these things, you are in real trouble. You need to stop eating those things immediately. Margarine was one of the worst ideas in the history of the food industry, And that's saying a lot because they've had a lot of really bad ideas. But margarine was one of the worst. Margarine is known as trans fats. And trans fats are very inflammatory to your system, leading to chronic diseases like cancers and many other inflammatory and autoimmune conditions. Avoid trans fats at all costs. But these trans fats, along with the sugars, are the cause of inflammation in the endothelial lining of the vessels that begin the plaquing process in heart attacks. Another example of trans fats are all of the seed oils that are now in everything. Safflower oils, cottonseed oils, canola oils. All of these oils are trans fats, and they are extremely inflammatory. You may look on the ingredients and see partially hydrogenated oils. If you see that, do not eat it. Because if you really look at the research on this, even the small sticky cholesterol particles won't stick to your artery walls unless those walls are inflamed first. And it's the sugar and trans fats that causes that inflammation. So that's the most important way to solve plaquing and keep that down in your arteries. If we keep your inflammation down, even if you have a genetic component to the sticky particles, you still will not get plaquing and your heart health will be great because it's the inflammatory process first. It all revolves around reducing the inflammatory process, and the typical American diet is the most inflammatory diet ever created. I couldn't write a more inflammatory diet if I tried to. The safflower oils and the seed oils in all the processed food, loaded with sugar, the phosphoric acid and carbonation in all the cold drinks and the sugar that's in there, the chemicals and preservatives that are in our food, the genetically modified soy, wheat, and corn. Other countries won't even take our food anymore. These things are creating many of the chronic diseases, including the inflammatory process that causes heart disease and cancer. So I want you guys to know, any of you out there suffering with cardiovascular concerns, there are so many things we can do in addition to the traditional route that can help you live a longer, healthier, better life so you don't have to wait on them to bail you out. Many of you may be out there right now wondering where all of this science is and what you should be working on. So I'm going to list all of this on my social media. And if you're interested in talking to me about ways to improve your heart health, that's what we do right here at Dr. Kevin's Wellness Clinic behind Women's and Children's right here in Lafayette. Thank you guys for joining me for another podcast. Love you, Acadiana.